So the exercise we'll be doing today is called pendulums. We'll be doing this for the inflammation phase. So to set up for the pendulums, all we're gonna do is pretty much just set ourselves up with a table. We're gonna use our unaffected hand, which is the left, and then the affected arm is gonna be the right. So we're gonna have a staggered stance. Kind of put your left arm on the table. Make sure you have a nice and neutral spine. You're gonna let your arm kind of dangle with your right, so you're gonna let the gravity do the work. So while the hand is dangling, all you're gonna do is pretty much just sway your back and forth, making it go in a circle, straight, side. But for this purpose of this exercise, we're gonna do the circular motion. So we'll just let it sway, let the gravity do its work. This is a very passive stretch on the shoulder, just getting some motion in there without actually moving your shoulder. We're gonna go for about 20 circles clockwise, and then if we're done with that one, we're gonna go counterclockwise. That opposite. So we'll go ahead and have you do it. Okay. Let's go back a little bit. Got it. Make sure you have a nice and neutral spine. Good, straight back. Just letting the arm dangle. There you go. Sway your body back and forth. Let the gravity do the work. It's gonna go nice and circle. Once you have 20, you're gonna switch to the other side. Spotting just in case. Once you have 20, let's go and switch to the other side, making sure to rock with your body, getting that passive motion at the shoulder. Making sure you continue to breathe, good breathing patterns as well. For our next exercise, we're going to be doing the isometric abduction and adduction with a foam block. So what we'll do here, basically we're going to do the abduction. We're going to place the foam pad against the wall here. We're going to be doing our right side. So we're going to be a 90-degree bend at the elbow, pretty much standing nice and tall, neutral spine, contract the abdomen. All we're going to do is we're going to press against the foam block and against the wall. We're going to give it a good press, about 70 to 80%, and then we'll hold it for about 15 to 20 seconds. We'll do this about 4 times so we can get those rep ranges and the parameters correct. What we're targeting here is a good tension at the shoulder without actually moving the muscles and the joints and the limbs as well. Sounds good?
Okay.
Okay. So 90 degrees, staying nice and tall, neutral spine. And we're gonna press against the foam block and against the wall here. Give it about 70 to 80%. And then once you have 15 to 20 seconds, go ahead and relax. Perfect. Make sure you nice breathe. Try to continue your breathing patterns as usual. Try not to hold your breath. I'm here if you need a spot or anything. You should feel the tension on your shoulder. Perfect. Nice. Go ahead and relax. We'll take that foam block, we're gonna put it inside your armpit area here. So instead of going out, now we're gonna go for adduction. Okay. We're gonna go inwards this time with still that bend at 90 degrees of your elbow. Okay. So this time you'll feel it more inside your shoulder instead of the lateral portion. Okay. Similar thing, neutral spine, good breathing patterns. For our next exercise, we're gonna be doing a sideline external rotation. So we're gonna be doing this pretty much on the floor. So I'm gonna teach you how to do it first, and then we'll kind of follow along from there. Okay. So since the affected side is the right side, we're gonna be laying on our left side here. On our left, making sure we can have our knees bent or straight, whichever one feels comfortable for you. With me, it's just knees bent, so it's a little bit more comfortable. Our starting position is gonna be pretty much right hand is gonna be 90-degree flexion, and it's gonna be close to our ribs, and it's gonna be hanging out from the side. We're gonna grab this dumbbell, basically grab it from this starting position, and with our neck relaxed, everything is in line, neutral spine, shoulder girdle is tucked right behind you. We're gonna go external rotation, going up. That's good. Making sure that elbow is nice and close to your ribs. We're gonna get a good concentric contraction in middle delt and posterior delt as well. Okay. We're gonna do it nice and controlled. We're gonna do this for about 3 sets of 8 to 12 reps, trying to improve strength as well. Okay. We'll go ahead and perform that one. So go ahead and raise your left side. Make sure your head is nice and relaxed, not straining the neck or anything. You can lay on your elbow if you need to.
Like this?
You can have it straight. You can just lay on it.
Like this?
Straight up. Right there.
Oh,
Yep.
okay.
That's good right there. So you're nice in line. Elbow is at 9 degrees. Coming down, nice and controlled. You're gonna go up, making sure that elbow is nice and close to your ribs. Have a good breathing pattern here. And we're gonna do this for about 3 sets of 8 to 12 reps. How's it feel?
Solid.
Good.
Fire.
Awesome. Okay, you can go ahead and relax. We're gonna move into our next exercise. We're gonna be doing the kneeling banded internal rotation here. So what we'll do is we'll pretty much stay in a kneeling position. Right leg is kind of down, left leg is stabilizing. So what you'll do here is grab this band right behind it. All you're gonna do, you can position your elbow about 90 degrees. Now you can bend at the elbow, making sure your spine is nice and straight, abdomen is contracted, shoulders nice and back, down and back, okay? From right here, all we're gonna do is we're gonna go internal rotation, going in, making sure everything is in line. We're gonna perform same reps, 3 sets of 8 to 12. We're gonna go in and up, making sure it's nice and controlled. So we'll give this one a shot. Perfect. Make sure everything is in line first. Use a comfortable spot. Contract the abdomen, neutral spine, shoulders down and back. All we're gonna do is go in and out. Making sure it's a nice controlled motion. Breathing pattern is correct. Making sure that elbow stays nice and high. Good. So this will mimic that throwing motion when we translate it over to the next phase. How's it feel? So today we're going to be doing our Arnold press. For this exercise, I'm going to show it to you first. So what we'll do here is we're going to stand up nice and tall. We're going to have one dumbbell on one side. All we're going to do is we're going to take it into this position first. And then from right here, with our palm facing towards you, we're going to press up, and then we're going to twist that palm right out. So we're going to be doing this motion right here. Make sure you have a nice neutral spine, core engaged, and you're breathing properly as well. Yep. First the core, twisting up. It's going to work on that anterior delt. And we're going to go for about 2 sets of 10. Try to push the core. Proper breathing. And it should be good. For this exercise, we're going to be doing some banded rows. We'll do it standing up. So what I want the patient to basically do is stand right here so we can assess the height of the band. So we're going to put it level to the chest, about right here. It's perfect. And I'm going to go ahead and demonstrate it to you first. So what we'll do here is we're going to stand up right in front of the bands. We're going to bend our knees slightly for stability. All we're going to do is we're going to take your 2 bands, hold it with 2 hands, and then we're going to pull back, taking those elbows back, and maintaining that neutral spine. When you're pulling back, I want you to breathe properly as well. So you're going to exhale right here and inhale. We're going to do this for about 3 sets of 12 so we can pretty much strengthen the back muscles and your posture as well. So staying back, same slight bend. We're going to take that elbow back, maintaining nice and neutral spine. Engage the core, and then we're breathing as well. If you want to make this a little bit harder, you can have the patient stand on one leg, kind of make it a balanced work while pulling as well. And if you want to regress, make it a little bit more easier, you can have her seated, and we can have her come closer to the band as well. So I'm going to go ahead and spot you for this one just in case. Just pulling back, straight spine, and then we're going to do 3 sets of 12 for this one.